I'm Yash. My research paper was Patient Perception of Health Information Exchange, a pilot program in South Korea. After reading the paper, I faced few interesting challenges in classifying the study design. The primary challenge came from trying to determine if it fit better as an observational or quasi-experimental study, given that it involved both structure survey and pre and post implementation phase of HI system. One key difficulty was that, unlike a traditional experimental design, the study did not randomly assign participants to different conditions. Instead, it followed patients who either participated in the HI or remained in the offline based system, forming a natural comparison groups. This setup made it tricky to classify because it did not meet the strict criteria for experiment. Even though it was a tracking change over time, which is hallmark of quasi-experimental design, some aspects were easy to identify. For example, the use of structural survey instruments to collect data on patients' perceptions, preference, or concern fit well within a descriptive framework. However, deciding on the study exact design type required a close look at how it managed control and comparison. Since there was no direct manipulation or randomization, I ultimately classify it as quasi-experimental study. The natural comparison groups provide a meaningful insights but lacks the rigorous control found in true experiments, making the quasi-experimental label more appropriate. To reach this conclusion, I reviewed the methodology section of this paper in depth, focusing on how the survey were used and how patient groups were formed. I also considered the objective of the study, which aimed to observe changes in perceptions due to HI experience rather than test a hypothesis through controlled manipulations. And working through this challenge highlight the importance of understanding the practical constraints and the goal of the study. The study design here provide a valuable insight into patient perspective in real-world healthcare setting, even without traditional structure. Thank you for listening.